Good afternoon, everyone. We're going to get started. I'm Nancy Kelly from the New England QIN-QIO. Thank you for joining us for today's webinar on smoking cessation. It's the 7th webinar in a series for the New England Home Health Collaborative. Before we get started, I'm going to quickly review a few housekeeping items. This webinar will be recorded and will be available within a few business days on our website. I'll provide you details on accessing the recording at the end of this webinar. So phone lines will be on mute for the duration of the presentation. However, we will take questions at the end, and I will provide you instructions on how to unmute your line at that time. So now I'd like to introduce today's speaker, Ann Olson. Ann is a home health expert supporting the New England QIN-QIO and filling in for Kathy Roby. Ann's past experience includes serving as the CEO of Interim Healthcare of Hartford, Inc., a full-service home care agency where she drove consistent quality and financial outcomes and led diversification through expansion to include a licensed home hospice division and a registered personal care and support division. Ann, take it away.
Hi, good afternoon, everyone. I'm really privileged to be here to speaking with you, and again, sending Kathy Roby's regards to everyone. She's here in spirit for sure. So just to review again that we are here today representing the New England Quality Innovation Network. As you all know, the CMS did consolidate the QIOs from 53 to 14 QIN-QIOs. We work in partnership with health-centric advisors and Qualidigm and service the 6 New England states, Mass, Maine, Rhode Island, Connecticut, New Hampshire, and Vermont. Our QIN-QIO website, as you all I'm sure are aware, is on the screen just for your reference. And just to review again, as Nancy has said, these webinars are recorded and you can always access the information for yourself or to do other additional staff training. You would just go to the New England QIN-QIO website, click on Providers, then you would click on Home Health. From there, you would see across the bar events, which is circled there for you, and then you would see the upcoming events. If you scroll down, you would be able to see prior events and recorded webinars, as I said, for your reference or for any educational programs that you wanted to do. So today we're talking about the smoking cessation, which, as you know, is the S of the ABCs of the data registry that we've all been working with, and again, appreciate your participation in that. The goals of our program today, are to increase your awareness of the incidence and impact of tobacco smoking, to recognize the evidence-based cessation programs and resources available to you, and then identify behavior change strategies so that you can promote cessation success with your clients. So we wanted to just try to level the playing field and look at what we know about tobacco use and cardiovascular health and what we currently know about smoking cessation. It occurred to me as I was researching this topic, there has been so much talk about the cigarette warnings and labels back in the 60s when that all was released, and feeling like tobacco use has somewhat subsided. But when you look into the statistics, I think you'll see that it has not reduced in the way that we had all hoped, which is why we're focusing on that today. So we're going to go through a few questions and welcome you to participate in the answers, and then we will be tallying the results as we go forward. So the first question is, tobacco use remains the leading cause of preventable morbidity and mortality in the U.S. Is that true or false? And please be sure to hit the submit button, which is on the bottom right corner of your screen after you've selected your answer. And we'll give you a few seconds to do that.
Emily, will you be doing the polling question?
Yes. Which one needs to be opened?
The first one, the true or false.
So while the answers are being told, I just wanted to relay what the answer is, and then we'll see how well everyone did as far as what the correct answer. So the question, the answer to the question is true, that tobacco use does remain the leading cause of preventable morbidity and mortality in the U.S. That is, and again, most of the information we're talking about today is in the best practice information on page 48. According to Dr. Koop, the former U.S. Surgeon General, cigarette smoking is the chief single avoidable cause of death in our society and the most important public health issue of our time. So this continues to be a consistent problem in the U.S. What we ended up coming with was 67% of you got it correct. So everyone that answered got it correct. So good job. So the second question that we had is, what is the prevalence of tobacco smoking? We have A, 3 in 5 adults smoke tobacco and 90% do every day. 1 in 5 smoke tobacco and 78% do every day. And C is, I don't know. So while the answers are coming in, the answer to this question was B, that 1 in 5 adults smoke tobacco and 78% do so every day. The results that we had 17% answer A, 50% got the question correct, 1 in 5, and a few people did not answer, so. Great job. So question number 3, the direct relationship between tobacco smoke, and that includes both directly inhaled and secondhand smoke, accounts for which of the cardiovascular risks in persons over 35 years of age? 33% of all cardiovascular disease deaths, 20% of ischemic heart disease deaths. C, persons with other risk factors, which would be high cholesterol, hypertension, diabetes, are 4 to 8 times more likely to develop heart disease, or all of the above. It's more likely to. Hi, so the answer to this question, I'm sorry about the delay there, is D, all of the above. The effects of smoking are 33% of all cardiovascular disease, 20% of ischemic heart disease, and people with hypertension, diabetes, and high cholesterol are 4 to 8 times more likely to develop heart disease if they smoke. I think these numbers show that there is a direct relationship between tobacco smoke and higher cardiovascular risk, and that is really why we're focusing on this measure in the Million Hearts campaign, so that we can prevent 1 million strokes and heart attacks by 2017, and really why our discussion is so relevant here today. So the polling answers, we had 67% say all of the above. So great job. Again, we've got a very smart group out there. So question number 4, to determine if a patient is ready to make a decision to quit, the DARN-C model presented in the work of Miller-Rolnick in 2008 can be helpful by incorporating the following change talk categories: desire and ability, reasons and needs, commitment, A and C, or A, B, and C. And the answer is E. So it would be A, B, and C. It stands for desire, ability, reasons, needs, commitment. Those are the 5 categories of change talk that can be helpful to determine if a patient is ready to make the decision to quit. And again, as our answers, we have 54% of the people that answered correctly were E, so great job. Question number 5, which of the following is the most effective intervention to promote tobacco cessation? Behavioral counseling, smoking cessation medications, support system, or all of the above? And the answer is all of the above. So effective intervention most times is not just one approach, but it's a combination of strategies that will achieve a positive result. So the answer is a combination of behavioral counseling, smoking cessation medications, and a good support system is what would be the best recipe to promote tobacco cessation. Because quitting is really something that is really very difficult, we need to educate our staff on effectiveness of combining the evidence-based tools and resources that we're going to talk about today, the medications, and also rallying support systems for our clients. The answers from the group were 69% got the answer correct, so great job. So moving forward, now that we've got some baseline statistics, looking at, what our action plan would be to, implement some strategies to impact this challenging condition, what we are looking at is staff education, obviously, on their important role with smoking cessation to reduce cardiovascular disease, and as with many of the diseases we've already talked about, looking at the awareness, assessment, and action that can be implemented. We can also look at competency testing like we did at the beginning of this presentation, both pre and post, to see what their baseline knowledge is, and then after providing some information, what their post knowledge is. We're going to look at providing them 3 interventions that they can use to improve patient outcomes, and then obviously review the data collection process, which is key to our data registry that we're all participating in. I mentioned earlier the best practice intervention package, otherwise known as the BTIP. This is really the resource that I used for the presentation today, and most of the information, I would encourage that you go in to the HHQI website and look at the BPIP. It does have all of the tools, many resources that you can use for your staff and for client education. And I, again, encourage you to download the information, review, and utilize it, as it will really give you the detail that supports the overview that we're going to be talking about today. So looking at tobacco smoking, an assessment process and an action plan, when we're dealing and you're talking with your staff about assessing your patients, looking at what the risk factors are, and are they really at a point that they're ready to quit. Obviously, on our OASIS assessment, we are assessing whether they are currently smoking, and that is where we should be exploring some of these areas, whether they are at a point that they are interested in quitting. And a couple of tools that the BPIP resource shared was the Conviction Confidence Ruler. This is a self-management tool that you can use to assess where the patient is in terms of their position on quitting smoking. They suggest that you would have the client circle where they see themselves. Are they convinced that they can do it? Are they confident that they can do it? And then from there, you can administer a tobacco questionnaire that will give you an idea as to how addicted they are to nicotine. And with those two indicators, you can proceed to the next step, which is really talking about action and motivational interviewing that can help lead patients to change behavior. One of the great tools that I thought I'd share is this box that you see on the bottom left there, which is based on the National Society of Health Coaches, their health behavior outcomes. And it's really a nice recap of how the interdependence between the health coach, being the home health care nurse, and the client, having the client be accountable and self-managing their tobacco use and trying to reduce that, and the health coach, the nurse, really doing motivational interviewing so that you're developing a partnership, goal setting that's based on the client's needs, their beliefs and concerns, and their culture, and obviously, ultimately, their agenda, so that we can develop goals that will help move them to reduce and hopefully quit smoking. The other guide that you see on the right is really looking at the DARN-C model, and that stands for desire, ability, reasons, needs, and commitment, which we talked about earlier in the pretest. But you can see across the top with change talk being, why they want to change, looking at examples of statements that the patient would say, but more importantly, examples of what the clinician can use for open-ended questions to really lead them to why they would want to quit and what is going to motivate them to go down this difficult road of stopping smoking. And you can see the questions on there. They're very intuitive and obviously, as I mentioned, open-ended, so that you're really getting the patient to explore, why and when. Are they ready to quit? Are they ready to pick a quit date, which is one of the key pieces that all of the literature talks about? What steps do you think you can do today and tomorrow to help you stop smoking? From those answers, we can take the next steps to hopefully developing a plan that will help them move toward reducing smoking and hopefully quitting. So looking at behavioral counseling, which is one of the other strategies that obviously, along with your motivational interviewing, behavioral counseling. There's an evidence-based free program online, which is mentioned there, from the University of California. They have curriculum packages with PowerPoints and notes, tools, resources that you can use to help patients quit. There's also the 5 A's from the American Heart Association, which are listed on the right side there, asking about tobacco use, advising them why, it's a good idea for them to quit, assessing their willingness, which we talked about with the DARN-C model, assisting them in their attempt to quit, using tools and resources to provide options for smoking cessation, and then arranging for follow-up. So the patient decides to quit during the current visit, and the date is set, so the home care nurse can plan their next clinical visit, if possible, for that day, or schedule a phone encounter to call and support them and encourage them and provide education so that they can follow through on the quit date that they've established. Another key point with this is the support system, and obviously home care, we're in there for a defined period of time. So really looking at, getting things in motion for your clients, but then looking at what are the resources in their community. There are various settings, both individual and group settings. There's the telephone hotline, 1-800-QUIT-NOW. And again, many community centers and support groups. And we really would want to help connect our clients to those resources so that they can carry through on some of the activities and strategies that we're able to put in motion. So one of the other key issues, obviously, with smoking cessation is nicotine withdrawal. Obviously, that is something that is the cause of many people not following through on their goals to quit smoking. The withdrawal occurs within 1 to 2 days of quitting smoking. It does peak within the first week, and then it does typically resolve for most clients within 2 to 4 weeks. As we discussed earlier, most times it's not just one approach, but a combination of strategies that will achieve a positive result. So the effects of nicotine withdrawal really need to be acknowledged and addressed, depending on each client's situation. The 4 Ds that you see listed here are ways for clients to when they're not using medications to deal with the nicotine withdrawal, which we're going to go through some of those resources, but they can try to distract themselves. There's different strategies that you can suggest to change their routine or spend time in an area where smoking is not allowed. The D for deep breathing, when they have an urge to smoke, or taking a 1-minute vacation, which has been proven to help clients get over those periods of nicotine withdrawal. Drinking water, 6 to 8 glasses of water a day has been shown to help clients during this nicotine withdrawal phase. And also trying to just change your routine and do something else. So reaching out to a support person, having smoking substitutes handy, whether that's carrots or gum, toothpicks, breath mints. There are many substitutes, and again, this is really about talking with your client and seeing what would work for them. A big area is changing the after-meal routine, since that's a very current or very prevalent time that people do smoke. So change that routine so that you can distract yourself from the nicotine withdrawal symptoms. Incorporate exercise, visiting with friends, movies, and sharing feelings with a friend or in prayer. So some of the smoking cessation medications. There are a variety of them that are FDA approved. We also have the nicotine replacement therapy, seen often in the literature as NRT, and we're very familiar with these. Those are your nicotine patches, gum, inhalers, lozenges, and nasal spray. Many times that is effective for clients, but for a lot of clients that is not enough for them. So we do see physicians ordering second-line medications, which actually can be used in combination with the NRTs, and the common bupropion and varenicline, which is Chantix, are the popular ones that you would see. I've put on your screen the pharmacologic product guide, which is the FDA-approved medications for smoking cessation. Again, this is available in the BTEC. It's helpful to know that it summarizes in one place the products, the precautions, the dosing, the adverse effects, the advantages, disadvantages, and costs for each of the NRTs and medications. And it's a helpful tool for reviewing with your staff so that they can have that to review with their clients. Although electronic cigarettes are not one of the FDA-approved strategies to reduce smoking, this is something that we're seeing much more popular, especially among our younger adults. And I thought it would be helpful just to mention. You can see the picture of the e-cigarette on the right side there. And they are battery-powered devices that simulate and substitute for regular cigarettes. Again, these are unregulated, and although the FDA has posted warnings and concerns, the studies do show that e-cigarettes do contain carcinogens and toxic chemicals, including diethylene glycol, which is an ingredient in antifreeze, which is kind of concerning. And then nicotine, which obviously is highly addictive if vaporized and inhaled. So again, I think it's just something to be aware of, and many people think by using these cigarettes they are, in effect not smoking, and that is not actually the case. And although the results are not 100% proven at this time, I have a statement from the CDC director that says, the CDC director is Tom Frieden, and he says e-cigarette use is growing rapidly, and there is still a lot we don't know about these products, including whether they will decrease or increase the use of traditional cigarettes. So stay tuned on that, but just be aware of some of the concerns. Talking with your staff, give them that information so they can share it with their clients. So when we're looking at patient education, obviously we always try to use a self-management approach, which we've talked about with our motivational interviewing. What is the patient's personal life goal? Can we help them see the relationship between compliance with the goals that they set and then meeting that goal? Obviously, using language-appropriate tools, depending on the community that you're working in, and incorporating your teaching relationships into a culturally appropriate framework. I've listed a few other resources here, obviously on the Home Health Quality Improvement website, the BTIP, which I've referenced several times. There's also a great article in the Wall Street Journal. Sometimes we find it's nice for clients to get something that's not technically a health publication, but obviously they can relate to and can reinforce a lot of the teaching that your staff is sharing. So I'd encourage you to look at that. And also the American Lung Association has released a document on how to help clients quit smoking. It's a nice, just step-by-step approach that I would recommend you look at as well. So moving on to our data abstraction tool, and again, we want to thank you for your participation in the HHDR data registry so that we can track how our interventions, our teaching, our focus on the ABCs can reduce the incidence of stroke and heart attacks. So today we talked about smoking, and as you can see on the data abstraction tool on the bottom right, that's where the smoking indicators are. For this area, the questions are pretty self-explanatory. During this episode of care, was the patient screened for tobacco use by the Home Health Agency? As mentioned previously, that is asked on your OASIS question on the M1036, and obviously they would answer that, so you could check yes. If yes, was the patient identified as a current tobacco user? Obviously that depends on the client. And then if yes, did the patient receive tobacco cessation counseling? They're looking for 3 minutes or less, or pharmacotherapy. And again, we would hope that based on our discussion today that you could check yes on that as well. So we're always trying to make data collection easier. That's something that is a challenge for all of us, regardless of which setting we're in. We recommend that you include the HHQI smoking cessation literature for cardiovascular risk in your admission package, if at all possible. Also, you could insert the data collection tool in the front of the chart so that the staff can check off that on admission and complete on discharge. That just makes the abstraction easier. And if you could identify a central location for the completed tool, that way the entry into the HHDR data set is easier and more efficient. So again, looking at the Million Hearts campaign, as I mentioned, the goal of the Million Hearts campaign is to reduce heart attacks, death by heart attacks and stroke by 1 million by the year 2017. How can your agency support cardiovascular risk reduction and smoking cessation? Hopefully some of the strategies that we've talked about today will help empower you and your staff to be able to impact this very significant health concern. Agency non-smoking policies, if you can advocate for that within your own agency, that many times will carry down to the staff and into their education with your clients. If your insurance plan does offer discounts for non-smokers, cessation classes, again, if you embrace a non-smoking atmosphere in your agency, it makes it more front and center for all of your staff. And then for the clinical staff, for the home health aides, for the therapists that are going out into the home, it becomes a normal course in the day to be emphasizing and supporting smoking cessation and reduce tobacco use. One of the other strategies is to sponsor exercise in the agency, just to have maybe noontime walkers. That's also been seen to, again, be a good distraction for smokers and is also a healthy alternative. So looking at peer-to-peer sharing, and with everything that we do in healthcare, it's always a good idea to share what's working, what's not working. The goal is always to improve our outcomes. with each episode of care for the clients that we take care of. By working together and sharing ideas, we can help each other and improve the outcomes for all of the clients that we are working with. And sharing these processes and suggestions on the monthly webinars, we would love your feedback so that we can, again, relay that and just make a pool of information so that we can be as effective as possible. If you do have a process, a suggestion, or an idea that you'd like to share, please forward that on to us so that we can use time in our agenda to share them back with the group.
Okay. Thank you, Anne. So at this time, we'll go ahead and take a few questions if anyone has any. If anyone on the line would like to ask a question, please press *6 on your phone to unmute your line. No questions. I'll put out one more time. If you have a question, just press *6 on your phone to unmute your line. Okay, I don't think we have any questions. Okay.
So the next webinar then for the New England Home Health Collaborative will be on the role of immunizations in decreasing acute care hospitalization and emergent care. That should prove to be an excellent program, and we would invite you to participate in that. That will be held on Wednesday, September 9th from 2 to 3 p.m.
Okay, and thank you all again for joining us today. I just have a couple of quick last announcements before Anne closes up here. When you close out this webinar today, you will be directed to a brief evaluation. We ask that you please fill it out if you have time now. If you don't have time or are sharing a computer with someone else, you will receive a follow-up email tomorrow with a link to the evaluation. Once again, we ask that you please complete it as your feedback is very important to us and helps us to provide you with meaningful programs in the future. In the email tomorrow, we will include a link to our website where you will be able to find the presentation, recording, and a transcript of today's webinar. They will be uploaded there within the next few business days.
Okay, well, thank you so much for your participation today. I do have Kathy Roby's contact information up on the screen. She would welcome any communication from any of you. And again, as I mentioned, sends her best to everyone and is looking forward to returning that first week of September. I have included my email as well. If there's any questions or anything I can help you with, please feel free to send an email my way as well. So thank you so much. It was nice meeting all of you through the phone lines here. I wish you a wonderful day. I hope your weather is as beautiful as it is here in Connecticut. And we look forward to talking with you again soon. Have a great day. Bye-bye.